A Chinese AI just diagnosed a cancer that 3 human doctors missed. Not in a laboratory, not in a controlled study, in a real hospital, with a real patient. A 53-year-old woman who had seen 3 separate physicians over 4 months received 3 separate clean bills of health and was sent home 3 times with the same conclusion. Nothing to worry about. The AI looked at the same scans the doctors looked at, the same blood work, the same symptom history, and it flagged an early-stage pancreatic malignancy that every human physician had missed. The tumor was caught at a stage where treatment was still possible, where survival was still likely, where the outcome was still something other than the statistic that pancreatic cancer usually produces when it is found late. That woman is alive today because a hospital in Shanghai deployed an AI diagnostic system that saw something 3 trained physicians did not. And here is what should make every healthcare system in the world stop and pay attention. That is not the exceptional case. That is becoming the normal case. Because in over 2,000 Chinese hospitals right now, AI diagnostic systems are running alongside human physicians on every case that walks through the door. Every case, every day, at a scale and a speed that the Western world has not yet processed the implications of. And the AI doing it just beat every other clinical AI model on Earth in independent testing conducted by Stanford University. In China this morning, a patient with chest discomfort woke up, opened an app connected to their wearable device, described their symptom, and had their complete medical history, 90 days of biometric data, and a preliminary AI assessment transmitted to a hospital before they finished breakfast. By the time they arrived, the cardiology department had their case summary on screen. The consultation took 11 minutes. They left the hospital in under an hour with a diagnosis, a prescription dispensed by a robotic pharmacy in 60 seconds, and a follow-up monitoring plan running through the same app they used that morning. In America, on the same morning, a patient with the same chest discomfort called their doctor's office. They were told the next available appointment is in 31 days. That is not a worst-case scenario. That is the 2025 national average for a new patient appointment in the United States. 31 days, up 19% from 3 years ago. If they need a cardiologist, the wait is 32.7 days. A gastroenterologist, 40 days. An OB/GYN, 41.8 days. If the chest discomfort feels urgent enough for the emergency room, the median wait before anyone sees them is 163 minutes. More than a quarter of admitted patients wait longer than 4 hours for a hospital bed after being seen. Same planet, same decade, 2 entirely different centuries of healthcare. The gap between those 2 mornings is not primarily a technology gap. The technology to build what China built existed in the United States too. The gap is a deployment gap, a policy gap, a decision gap about whether the transformation of healthcare is something to pilot cautiously or something to execute decisively. China made that decision in 2014. In 2014, China's government introduced the National Smart Hospital Initiative and embedded smart hospital performance metrics directly into the evaluation system for public hospitals. This was not a funding announcement or a research grant program. It was a policy decision that tied institutional performance ratings and the resources that flow from those ratings directly to technology adoption and effective use. When institutional survival depends on technology adoption, adoption stops being optional. A decade of that incentive structure produced something that voluntary adoption driven by individual hospital enthusiasm could not produce at the same speed or the same scale. The Western analysis of China's healthcare AI consistently focuses on the technology. The more important story is the governance. The technology was available. The deployment speed difference came from the policy environment surrounding the technology. Understanding that distinction explains why catching up is harder than it appears from the outside. By 2025, the results of that decade were visible in ways that independent measurement confirmed. At Zhongshan Hospital in Shanghai, a multimodal AI platform integrating imaging analysis, voice-activated clinical documentation, and real-time diagnostic decision support processes, radiology studies in seconds rather than the 30 minutes. A skilled radiologist requires manually. Diagnostic error rates in pilot departments fell by 15%. Radiology report turnaround dropped by 90%. 90% faster turnaround on radiology results for a patient with a potential malignancy is not just an operational metric, it is a human metric. The anxiety of waiting for results is a clinical outcome. Reducing that wait from weeks to hours has measurable psychological and physiological consequences for the patient sitting at home wondering, At Ruijin Hospital, an AI pathology system processes 3,000 pathological slides per day, a volume that would require an entire department of specialist pathologists working continuous shifts to match manually. 3,000 slides per day from one system in one hospital. Scale that across 2,000 hospitals, and you start to understand what national deployment of this technology actually means for diagnostic capacity. Then January 2025 happened, and everything accelerated. DeepSeek was released. You probably remember the headlines. The AI model from China that matched the performance of the world's leading systems at a fraction of the cost and with a fraction of the computing resources. The story dominated technology coverage for weeks. American technology stocks fell. The competitive implications were debated extensively. What received almost no coverage was what happened in Chinese hospitals. Within weeks of that release, hospital after hospital began integrating DeepSeek's large language models into clinical workflows, not as a trial, not as a committee-approved pilot program being cautiously evaluated, as the operational system replacing or supplementing whatever they had been using before. By March 2025, over 300 hospitals had deployed DeepSeek for clinical diagnostics and medical decision support, running entirely within hospital firewalls so patient data never left the building. Now, the number that changed the conversation globally, Stanford University conducted an independent benchmark evaluation of 9 leading clinical AI models, American models, European models, models developed specifically for healthcare with years of dedicated clinical training. 9 of the best clinical AI systems in the world tested against standardized medical knowledge assessments derived from physician licensing examinations, the same examinations that determine whether a human doctor is qualified to practice medicine. DeepSeek R1 finished first. 66% win rate against every other model head-to-head, a macro average score of 0.75 across all assessment categories. The top-performing clinical AI in independent testing conducted by an American university was the same model that was simultaneously being deployed across Chinese hospitals at national scale. Not in a laboratory, in hospitals, with patients. Now, here is where the story shifts from impressive to genuinely historic. On the 26th of March 2026, China opened its first fully integrated AI hospital. Not a hospital with AI tools layered onto an existing system, not a hospital with a smart scheduling application and an automated pharmacy, a hospital where artificial intelligence is embedded into every stage of the care continuum: prevention, diagnosis, treatment, rehabilitation, long-term health management, every stage AI native from the ground up rather than AI augmented from a legacy foundation. It opened in Boao, Hainan province. On the same day, the 2026 Boao Forum in Beijing released the first internationally recognized definition of an AI hospital, the standard against which every hospital that claims to be AI integrated will eventually be measured. China did not just build the first AI hospital. China wrote the definition of what an AI hospital is. The Tsinghua AI Agent Hospital, developed as a simulation and research platform running alongside real-world deployment, has already processed more than 10,000 clinical cases with a 93.06% accuracy rate on the MedQA benchmark, the same standardized assessment used to evaluate human medical licensing candidates. The AI is passing the doctor's exam at a rate that would put it in the top tier of human test takers. It is being used to train the next generation of clinical AI systems before any real-world deployment, eliminating the risk of errors at scale before patients are involved. The equivalent of clinical trials for an AI system run in simulation, completed in weeks rather than the years that clinical trials for pharmaceutical interventions require. China's National Health Commission has issued formal guidelines directing AI integration across prevention, diagnosis, rehabilitation, and long-term health management. The full life cycle of care. This is not a corporate initiative or a technology company's product announcement. It is national healthcare policy, backed by regulatory force and sustained government investment. Now, the part that deserves honest attention. Because if this video only showed you the impressive parts, it would be doing the same thing that every promotional video about Chinese healthcare AI does, and you deserve more than that. The gap between what AI diagnostic systems can do in controlled conditions and what they do reliably across the full diversity of real-world patient presentations is real, and it matters. The 93% accuracy figure on the MedQA benchmark is genuinely impressive. It is also a benchmark score. Benchmarks measure performance on standardized questions with standardized formats and standardized answer structures. Real clinical medicine involves patients who describe symptoms imprecisely, who have multiple overlapping conditions that complicate each other, who have social and psychological contexts that affect both their symptoms and their treatment options, and who sometimes cannot or do not provide complete information. AI systems that perform extraordinarily well on benchmark assessments can underperform on the specific patient in front of them when that patient's presentation does not fit the patterns the training data prepared them for. The AI that correctly diagnoses 93% of standardized cases may miss a meaningful percentage of unusual presentations that a skilled human clinician with intuition built from years of direct patient experience catch. This is not a reason to reject the technology. It is a reason to deploy it the way the best Chinese hospitals are deploying it, alongside human physicians rather than instead of them. As a decision support tool that surfaces information, flags possibilities, and catches things that human attention might miss while keeping human clinical judgment in the loop for the interpretation and the final decision. The hospitals where AI is working best are not the ones that replace physicians. They are the ones that gave physicians better tools and freed their time and attention for the clinical judgments that human expertise is still uniquely suited to make. The cancer that 3 doctors missed and the AI caught was caught because the AI processed imaging data with a consistency and a pattern recognition capability that human visual processing cannot match at scale. The AI did not replace the physician who reviewed the finding and made the treatment decision. It made sure the finding was not missed before the physician had a chance to review it. That is the model that works. That is the model China's leading hospitals are running. And that is the model that the rest of the world needs to understand before it either dismisses what China has built or overclaims what it can do. Here is what the United States was doing during the same period. The average American patient now waits 31 days for a new doctor appointment, the longest recorded average in the country's history, 19% higher than 3 years ago. American hospitals collectively transmitted 9 billion pages by fax in 2023. 9 billion. 60% of American hospitals use fax as a primary method for transferring medical records between facilities. The country that invented the internet, that built the companies that created the AI systems that are transforming healthcare in China, is still using technology from 1964 to move patient data between buildings across the street from each other. This is not a technology problem. American technology companies built DeepSeek's competitors. American researchers developed the imaging AI that now runs in Chinese hospitals. American universities produced many of the engineers implementing these systems. The technology exists in America. The deployment does not. The reason is structural. American healthcare is organized around a payment and liability system that creates powerful incentives against rapid technology adoption. A hospital that deploys an AI diagnostic system, and that system contributes to a diagnostic error, faces liability exposure that the hospital's legal department will spend years trying to avoid. The rational institutional response to that exposure is caution. More studies, more pilots, more committee reviews, more regulatory consultation, and meanwhile the patients wait. China's system created different institutional incentives, not necessarily better incentives across every dimension, but incentives that produced faster adoption of technology that demonstrably improves diagnostic outcomes at scale. The NHS in the United Kingdom has piloted symptom triage chatbots supervised by physicians. Singapore has deployed pharmacy robots and elder care monitoring. Germany has electronic health record systems that are more integrated than American ones. These are genuine advances. They are also additions to existing legacy systems. They are not structural redesigns. What China built is not an addition to a legacy healthcare system. It is a parallel architecture, AI at the center, human clinical expertise working alongside it rather than buried under administrative burden. The difference is not a software update. It is a structural redesign of how healthcare functions as a system. Here is what the next decade looks like if the current trajectory continues. AI-assisted diagnostic systems in China are targeting 80% primary care coverage by 2027. That means 80% of primary care consultations in China will have AI diagnostic support within 2 years. Emergency rescue systems using AI sensors are already reducing critical response times by over 40% in deployed areas. China's smart healthcare market is projected to reach 12 billion yuan in 2025 and is compounding at over 50% annually. The compound growth rate is the number that matters most for the long view. A market growing at 50% per year doubles in approximately 18 months. The system that exists in 2,000 Chinese hospitals today exists in 4,000 in 18 months. The AI that is covering 93% of China's provinces today covers deeper and more comprehensively in 2 years. The capabilities that are impressive today become the baseline from which the next generation launches. Western healthcare systems running on fax machines are not standing still. There is genuine investment in healthcare AI in America, in Europe, in Australia, in the advanced economies that have the resources to make the transition. The question is not whether they will eventually make it. The question is what the gap looks like when they get there and what the cost of that gap has been for patients who needed better health care during the years the transition took. 31 days to see a doctor, 163 minutes in an emergency room, 9 billion fax pages. These are not statistics about a healthcare system that is on the verge of transformation. They are statistics about a healthcare system that has not yet felt the urgency of the alternative that exists on the other side of the world. The urgency is becoming harder to ignore. Here is the question that this story ultimately raises and that nobody has a clean answer to. What happens to the global standard of care when the country with the most people on Earth deploys AI diagnostic systems that outperform the global benchmark in independent testing across 2,000 hospitals under national health care? Policy? The answer is that the global standard moves not as a voluntary decision, not because other countries decide to adopt Chinese standards, but because the demonstrated performance gap between what AI-assisted diagnosis achieves at scale and what legacy diagnostic systems achieve without, it becomes too large and too well documented to continue characterizing as a pilot program worth monitoring. The cancer caught because an AI saw what 3 doctors missed is a data point. 10,000 cases at 93% accuracy on physician licensing benchmarks is a data point. 300 hospitals deploying a clinical AI system within weeks of its release because it demonstrably improves their performance. Evaluation metrics is a data point. The first fully integrated AI hospital opening with a government-written definition of what an AI hospital means is a data point. At some point, the accumulation of data points stops being a story about what China is doing and starts being a story about what the global standard of medical care is becoming. That transition is already happening. The only question is which healthcare systems are part of shaping it and which healthcare systems discover it has already happened when the gap becomes impossible to close from the outside. China did not wait for the perfect regulatory framework. It built the hospital. It wrote the definition. It started seeing patients, and the AI seeing those patients just beat every other clinical AI on Earth in testing that an American university ran. The morning where you wake up with chest discomfort and the system already knows you need to come in before you do is not science fiction. It is Tuesday in Shanghai. The question for the rest of the world is how long Tuesday takes to arrive. If this changed how you think about where healthcare is actually going and how fast it is going there, hit the like button. 1 second of your time makes a genuine difference to whether this reaches the people who need to think about it. Subscribe and turn on notifications because this story is adding new chapters faster than most people realize. Drop a comment and tell me honestly, would you trust an AI system to assist in your diagnosis? Not replace your doctor, assist. I want to know what you actually think. I read every single one. See you in the next one.